Good evening to all. The 42nd medical term that we'll be discussing today is about the organ, the lung. So, of course, as we know, that we have a pair of lungs, two lungs, on either side of the mediastinum, that is the right and the left lung. So, what is this organ actually useful for? It is the primary organ of the respiratory system. That means it is helping in gas exchange. So, what is the general structure, the shape? It's a cone shaped, spongy organ in the chest cavity, right? So, as we know, in the middle of the chest cavity, there is a bone called the sternum, and from there arises the ribs, right? And below the chest cavity and above the abdomen, there is a separating muscle called the diaphragm, as you can see in the diagram. So, we have the right lung and the left lung, and both the lungs are covered by this membrane called pleura. It's a double membrane, and the space between the two membranes are the pleural cavity filled with pleural fluid. So the right lung and the left lung are separated into lobes, as you can see, the superior, the medial, and the inferior, the right. But left lung, of course, has only two divisions, the superior and the inferior. And these divisions are separated by fissures. So in the right lung, you have two fissures, horizontal fissure and the oblique fissure, whereas in the left lung, you just have only one fissure, that is the oblique fissure, right? So what happens is, as the lung is the main respiratory organ, it receives the air in a particular pathway, that is from the nose, trachea, bronchi, then the bronchial tree branches into bronchiole and then the alveoli. So when the capillaries are surrounding the alveoli, the capillary brings in the deoxygenated blood, that is with a lot of CO2. CO2 goes out, and the oxygen which is brought by the alveoli is taken into the capillary, and the blood becomes oxygenated. So this happens by inhalation exhalation procedure, which happens in opposite ways, where inhalation is when the diaphragm contracts, intercostal muscles contract, that causes the chest to expand, and the pressure in the inside becomes lesser, and thereby air flows in. And the exact opposite happens in the exhalation process. So we need to protect our respiratory system because it may cause pneumonia and chronic diseases like asthma, chronic obstructive pulmonary disease,